Welcome to The Spill, Season 2, Episode 6. In the first part of this episode, we will be speaking to two nurses about vaginal health and feminine hygiene. So stay tuned for this very interesting discussion on The Spill. And thank you so much to our sponsor for this episode, Anu Maje, a cookbook by Victoria Matthew, Ophelia George, and Kerwin George. Nurses, welcome to The Spill. It is my pleasure to have you on with me on this episode of The Spill as we discuss some very important things about our vaginal health and hygiene. I want you all, as the very first time that I have two nurses on The Spill, to tell me a little bit about yourself and your nursing background. So I'll start with Nurse Christopher.
Good day, everyone. I'm Nurse Christopher. I work on Glover Ward, actually at Dominica Chinese Friendship Hospital. I'm an RN for almost a year now, and so far I say the experience is very, very good. I get a lot of practice, a lot of experience, and so far all is well.
And a little tidbit for our viewers. Nurse Christopher was a student of mine, so I need to push that in there. Just to give you some background. Nurse Alfred?
Okay, good afternoon. I am Nurse Alfred. I am originally the district nurse for the Bellevue-Chaufin community, where I also reside. But at present, I'm the community health nurse acting for the Roseau South district, that is Scott's Head to Newtown. I'm a registered nurse midwife, and I've been a nurse for almost 20 years. My mom is also a nurse, so it's in my blood.
It's in the family. Right. Nice. So, on this spill, we always want to talk about issues pertaining to women's health.
Yeah.
And on this episode, we are going to be talking about the all so important and much spoken about vagina that, ladies have. But sometimes there's a confusion about what exactly is the vagina. So I want to start off with that question. When people talk about vagina, what part are they really talking about, or what part are they supposed to be talking about when they use that word?
Okay, so the vagina is not the outside part, basically, in layman terms. It's actually the canal where, we give birth, what we call periods occur, menstrual periods occur, and also where we have penetration for sexual pleasure as well. It's often mistaken with the vulva, and the vulva now is the external part of the female genitalia, which includes the pubic mons, the labia, the external part of the urethra, and even the vagina, but the inside parts from the external opening towards the cervix. That's the vagina.
Yes. Ms. Christopher, you gave a good anatomical explanation. As your past teacher, I'm very happy with that explanation. And you are right. So many people confuse the vulva with the vagina. So when they talk about vagina, they're talking about the external part, but that's not what it truly is.
True. In entirety, it's not just the external part. So that's part of your reproductive organ. So yes, it extends all the way to the cervix. So usually they care about what is on the outside and not pay much attention to what is on the inside.
Right. And you say that, let me now lead to this. Why is it important for us to consider the health of the vagina, that part that we're talking about, that driveway, some might refer to it as, why is it important for us to think about the health of that part of us?
It's vital because if we look at she said about the functions of the vagina when she was listing what Nurse Christopher said about the functions of the vagina when she was listing what it is. for menstruation, for childbirth, for sexual intercourse, which is one key aspect that all humans, it goes favorable for them. If the vagina is not taken care of and it's not done in the right way, it doesn't remain healthy, then that means it interrupts the function of those events.
Yeah.
So when it comes to sex, you have painful sex and those things, and it can then interrupt you psychologically and physically. Yeah.
And that too can lead to problems in your relationship because the boyfriend or the partner think, oh, something wrong down there. I'm not in that.
And it can also affect your self-esteem because if you don't have a healthy vagina, apart from it being painful, or it creating a sense of shame because you're scared to have sex, you're scared to take out your underwear, you're scared to go and have pap smears, you're scared to get examined by a nurse, you always have a discharge or a foul odor. It changes plenty things in your personal self-esteem.
So your self-esteem can be affected.
Yes.
That is definitely true. And you're mentioning some things that are important. You mentioned discharge, you mentioned odor. Let's talk about some of the issues that may occur with our vaginal health. What are some problems that women face as it relates to their vaginal health? Any conditions or anything that, disrupts the health of the vagina?
Well, for sure, most common we have yeast infections. There are also STIs or STDs, sexually transmitted infections. And for those who may not know, there's also BV.
Bacterial
Vaginosis,
So
yes.
it's a bacterial infection. Yeah. So the vagina is not only there and every time you get an issue or you feel something like, let's say your discharge is different or something is different in your normal functioning or the way your vagina feels doesn't necessarily mean it's related to an STI, a sexually transmitted infection. There are bacterial infections that can occur, and there are certain things that might be so common in the way sometimes we take care of ourselves generally that we don't pay attention to, that will change the pH level of our vaginal cleaning agents and then create a sense of infection or some form of the yeast infection she was talking about.
Okay, so we've mentioned yeast infections, we've mentioned STIs, bacterial vaginosis. Give me some insight about what would be different about the vagina in terms of odor or discharge if a woman is suffering with any of these that you've mentioned.
Okay.
How would she know?
Okay, so normally your vagina is supposed to have a discharge. That is normal. Okay, ladies, it's normal for your vagina to be moist, and especially when you are sexually aroused during the time of your ovulation or your menstrual period time. There are changes during pregnancy. There are changes, normal changes that the body goes through, that you will see a change in your discharge. Either it is more, or it's sometimes with age, like women who are premenopausal or going through menopause, the discharge sometimes gets a little more dry. So that is normal, but that normal discharge is usually like a little white, cloudyish, and it can be very clear.
Yes.
But when you see a change in your discharge where it gets like a cotton cheese white color, it has a fishy odor, then it could be a yeast infection, and it causes itching of the vagina.
A lot of itching.
A lot of
inflammation, basically.
Yes. Or if you have cases where the discharge can have like a tint of a yellow color too.
Sometimes even grayish.
Yes.
Yes.
And then you have in cases where you have trichomoniasis the STIs like gonorrhea. The discharge will be green and extremely offensive.
Like a
So
dead
it will
fish,
not,
dead fish,
yes.
basically.
So it will go from the fishy, fresh, eggy scent to a dead fish, rottenish smelling kind of foul odor.
A lot of discharge. Sometimes it be watery, very white but thick, and then eventually the color change over time from yellow to green to gray. And it's very uncomfortable because you also have the itching, the pelvic pain, the redness, swollen, all sorts of things going down there.
And what about the bacterial vaginosis that you also mentioned?
So the bacterial vaginosis, usually you will see a discharge. The discharge can be somewhat looking like a little yellowish, almost pus-like looking. You can get that discharge.
Okay.
Now, something that is to be noted is that you will get women get that itching sensation, and when you start to itch, it feels good. Because 90% of women who come with these infections, but at the time they come to the nurses, when it gets to a point where they have itched so much, it's either it is red, they have started to bleed, or blister, and it's unbearable to even urinate, because the urethra has been bruised from all the itching. Because the itching sensation, more you itch is more you feel nice. But when the itching stops, then you have the after effects of the burning and the issues with having difficulty even urinating because it burns so much. So these are the key things. From the moment you realize that your discharge changes, then you should see your district nurse or your private gynecologist or somebody that you trust that is in the health system. You can ask the question.
Right.
Yeah.
So what you're saying, from what both of you all are saying, it's important then to be very observant about our discharge and the odor as well, right?
Yes. You have to pay very close attention to your vagina. I tell my clients, my patients, lie down and look at your vagina. Just like how you would stand in a mirror and you look at your breast, you brush your teeth, you look at your teeth, you put on your makeup, you make sure it's fine, look at your vagina. You have to pay close attention to it.
So if you depends on your flexibility, you know.
I know it's get trust in eyes.
But yes, the mirror trick can definitely work, and you can find a way. To look at it.
Yes.
So being observant about these changes, probable changes, in discharge, in odor. Now, ladies might think, and I know a lot of ladies do think, that such an important part, the vagina, it needs to be cleaned. So I want to know yours view or what you all know to be the correct approach to taking care of the vagina as it relates to hygiene. Is it a part that is supposed to be clean? And if so, what are you supposed to be cleaning it with? So let us know what your expertise says about vaginal cleaning.
Okay, so I see where you're going there. Well, first and foremost, we're in the 20th century, 21st actually. So you have a lot of douching going around. Douching is a no-no because the vagina, it can clean itself. It has its normal, natural bacteria to clean itself. So basically, when you douche, you're like squirting this little water into the vaginal canal. And what can happen, some water can get trapped in there, and that could lead to a breeding ground for bacteria, bad bacteria. And that now can affect the pH, your odor, and that can lead to inflammation and something going off one time.
Problem.
Also, when you flush with the douching, you're actually flushing out the good bacteria.
Okay.
So that could affect all the balances going on down here. So douching is a no-no. So basically, what I would recommend is that you wash with your normal running water, flowing water. If you want a little soap, mild unscented soap, but do not put the soap into the vagina.
Okay.
You wash the outside part, the vulva.
The vulva.
Yes.
Okay. And you're speaking about bacteria, and maybe we can get a little clarity because people who are listening might say, bacteria, what bacteria is, what are bacteria doing in the vagina? And then you spoke about good bacteria.
Yes.
So tell me a little bit about that bacterial nature that exists in the vagina. And you mentioned douching might disrupt that. But what is going on in the vagina in terms of bacteria?
Okay, so basically, think of it. There's a house, you're cleaning your house, you're mopping and so on. The so-called bacteria will represent you cleaning your house. And that bacteria, scientific name is called lactobacilli. It's the good one, which is used to clean our nice little house down here, make sure everything good, clean, sparkling, fresh. Now, imagine if you come with a bottle of Clorox, yes, to help to clean, but then too much Clorox, your whole house is going to smell Clorox. Everything just going to go off. Something going to trouble your nose, then you want to take something else to clean it, and then so on and so on until you have a big one pot, everything mixing up, and then something go off.
Miss Christopher, I like that analogy so much. So the good bacteria is you, the owner of the house.
Yeah.
You know, cleaning your place as normal. And bad bacteria when you have an influx now of some foreign or some bad
Yes,
bad agents.
Yeah.
Okay, nice. So we're saying that douching is a no-no. What about ladies who feel like the vagina should have, and especially because sometimes it's to impress somebody else, but the vagina should have a nice smell. The vagina should be, flowery in smell, and they might want to use things to change the smell
Because
of
of perfume.
yes. What about that?
Okay, well, the vagina don't usually have a flowery scent. That's not natural. That's fiction. So the normal scent, I would say, or the normal taste, if you want to go that far, for vagina would be like a sourdough bread or yogurt. It's basically more like unscented, but have that little tangy taste to it. Now, when you use feminine hygiene products like the sprays, the perfumes, and so on, you get that extra sweet scent. Yes, it might smell good, but again, the pH is going to affect your pH. And depending on what chemicals that's in that spray and so on, it have irritants, and that could cause an inflammation down there, and you might not even realize until after a few uses, actually.
Or you can get an allergic reaction to it too.
That as well.
And so in reality, it would not serve the purpose if you get an allergic reaction.
Okay.
But there are ways that you can change the taste, or you can promote a different taste to your to your vagina or to the vagina. So there are fruits. What we eat plays a very important role. So diet, everything is diet. Our diet and what we eat plays a very important role in changing certain aspects in the taste and how we feel. So pineapple has been one of the most famous fruits.
Oh, yes.
That it gives the vagina a sweet flavor, citrusy flavor, and the vegetables like asparagus would then give it the opposite, like a bitter and not really nice taste. So if you want to promote good and you want to give it a nice citrusy smell and flavor, then eat plenty pineapples. Pineapples not in season. No, where is it? Pineapple. and fruits and vegetables play a key role too in our thing. So it's not just pineapples. You can go online and you can research, and you'll get different fruits that promotes nice scents and good health when it comes to the vagina.
And I guess it's like anything else. It's the same way if your diet is rich in certain things. For instance, your body odor might reflect that. So it's the same. It's the same with vaginal health. What you eat, does contribute to odor as well. But we're saying though the perfumed products and the what you call it, those exotic scents and so on that people may encourage you to apply to be enticing maybe to your partner. We're saying we don't want to use those.
No.
Okay.
And it even goes into not just vaginal health alone, but even when we look well, sex is related to vaginal health. Where you have some condoms that are scented or flavored. There are women that will come and they will say they're allergic to latex. It's not necessarily the latex. Because it's a scented latex. It's like a baby being allergic to some of the diapers that have the blue dye in it. It's your body, because your vagina is a self-cleaning organ, as Ms. Christopher explained. God is such a good God that He created us to clean our own selves, because our stuff is inside. And so, because our body is cleaning its own self, it has its mechanism and its balance that it requires for the proper functioning and cleaning to happen. So anything that is chemical, that is added or enters that area is foreign, is going to change it. So for example, we were talking about yeast infections earlier. One of the things that causes yeast infections, normal, that we as nurses and doctors give patients antibiotics.
Antibiotics, yes.
So first generation drugs, where they treat how many different antibiotics that target how many different areas of the body. They're not specific to one particular thing. That
Right.
they are broad spectrum
Right.
antibiotics. When you drink them or you take them after a period of time, the women will say, "Nurse, I feel like my vagina is itching me," and that's a normal reaction because your balance of your pH level has changed a bit, and so that is the result of it.
Let me just ask you, what is the regular pH of the vagina? Like
reg-
not numerically, but where do we fall?
Where it's like slightly acidic.
Uh-huh.
It's a pH of 3.8 to 4.5. That's the
Right.
normal pH.
Yes.
Very little acidic because if it is too acidic, then there is where you have the burning. So I suspect sometimes when you look at when what research shows is that where the imbalances occur, you will see where the acid level is a bit higher, and that is where you are having the reaction.
Okay.
And also, if I may add, even during pregnancy, back to the BV
Yes.
as well, you have hormonal changes that could change the pH and the balance going down here, which could lead to the BV.
So true.
And for those who do not know, BV, the bacterial vaginosis, it is not an STI. It's just
No.
an imbalance
bacteria.
basically happening down there within the hormones and the so-called bacteria.
So you have the development of because the bacterial level is
Yes.
right.
So there's more bad than good.
Bacteria.
And actually, I've heard a woman talk about bacterial vaginosis in a way where her gynecologist actually said to her, she was trying to keep the vagina too clean. And that's why she developed the BV. So the same thing we're speaking about, trying to clean and therefore disrupting the good bacteria and allowing the bad bacteria to overgrow and overpopulate the vagina. So very interesting stuff.
To include, you see, when you spoke about cleaning, and so we say cleaning with water alone, but it's not just water because you're not supposed to take your finger and push up your vagina to clean. We do not encourage women to use wash rugs to clean their vagina. The vagina is a sensitive place. Water with your hand is fine, but don't stick your vagina up your finger up in your vagina
And
to
you're
clean
trying to scrub
anything.
inside there.
No,
No.
that's not. You're not supposed to do that at all.
Okay. Ladies, there is something that is very trendy these days, and it's vaginal steaming, where essentially you use hot water, you put some herbs in there, and you stoop over that container of hot water and allow the steam to rise into the vagina. Very trendy, and I wanted to know from you all your medical opinion on that practice, vaginal steaming. What is the standard about that medically?
Well, medically, I have not come across or have been taught anywhere where I should encourage women to do vaginal steaming.
Okay.
I think it's something of personal choice, but I don't think it has any medical benefits that we can sit and encourage women as that would be one of the procedures they should do in terms of their vaginal health.
Okay.
And another reason why I can't medically say to do this or encourage to do steaming is because depending on the temperature that we introduce to our vagina, that heats, that alone can be a breeding ground for bacteria.
Okay.
So I do not, unless I come across some research, I can't sit here and promote vaginal douching. However, steaming. However, I think everybody in our reality those days, those things are there and it's available, and people like to explore. So I'm not against exploring, but explore good in a good way. Research, make sure you are well educated and you know what you're getting yourself into. And it's always good to seek information from your healthcare provider.
Right.
Because imagine you do a vaginal steam today and then 2 weeks from now you have a body yeast infection or you have a
severe burn.
Severe burn.
Yes, because the skin is very delicate down there.
Very delicate.
So if that steam is too close, it could burn.
Yes, I remember some time back in my line of work where I came across women that would be using vinegar to wash their vagina. and that is a no. You have to be. That's why you use nothing but water, clean water. We're not saying to get warm water. We're not saying to use salt water. Clean water to wash your vagina. That does the trick. And if you do that and you do it properly, regularly, in the correct way, then that means that, and you do all the other aspects. So the wiping from front to back, changing your underwear frequently. If you use pads, make sure you change your pads, your panty liners, your tampons frequently. This, if you practice all your proper good vaginal care habits, then you should not have no issues with your vagina.
And we've been mentioning, or you both have been mentioning quite a few safe practices or best practices as it relates to our vagina and taking care of it. And I want us to just reiterate some of the strict do's and don'ts of cleaning or taking care of our hygiene, our vaginal hygiene. Some strict do's and don'ts. I know we've mentioned no
No douche.
no douching.
douching.
We've mentioned no insertion of
Foreign.
No fingers, no, well,
wash. Well,
dildo might be a
in
foreign.
terms of to clean.
It's to clean. Do not insert foreign objects to clean.
Clean.
Right.
And the washrooms,
Wiping from front to back.
Is a
That's
don't.
do. That's a do from
So you do
from
from front to back.
okay.
You don't
go from back.
go from back to front.
Okay, so no back.
If you're an individual who practice both vaginal and anal sex, you do not have anal sex and then have vaginal sex. And if you do, you change the condom every single time you're going to re-enter the vagina.
Okay.
And likewise, the anus. So if you're coming from the vagina, you're not supposed to just insert in the anus, because there is the bacteria that research has shown can affect, from the anus that can affect the vagina, and from the vagina that can affect the anus. So it has to go vice versa. You do not re-insert. And that goes for not just sex with like penile sex, but also you having your own masturbation or use of sex toys. You make sure you change condoms.
Okay.
Oral sex too, depending on the type, on what the individual has in their mouth, or if they have any bacterial infections or so in their mouth, then the oral hygiene is essential when it comes to oral sex, because depending on if the person has bad oral hygiene, it can cause you to have a yeast infection. So that is also important in doing. Yes, Christopher, you want to add anything?
No, I think you take most of my points.
I like that. So I think, and we get it into the very important discussion about sex. We're already getting into it. So, Ness, you just mentioned sex toys and insertion from one area to another, vaginal to anal or anal to vaginal. Let's talk about sex in particular and the use of sex toys. What are some of the things we need to pay attention to ensure that our vaginal health is maintained?
The sex toy is yours and yours alone.
Okay.
And yes, your sex toy should be yours and yours alone. And if your sex toy is being shared, it should be shared like how you would share it's your own partner. So a husband with a wife, a boyfriend with his girlfriend, that one sexual partner, you stick to one sexual partner. And if you are in a multiple sexual relationship at the time, then you ensure that you have your safe sexual practices. So if you're in something like an orgy or multiple sexual partners at one time having sex, you use condoms and you change condoms in between partners.
Okay.
So you make sure that it is kept safe. And that is the same, not just for sex toys, but even when we're doing like sexual practices with each other, humans having sex with humans.
Okay.
Yes.
And also, a point I must add, during sex, don't be shy. You sweat a lot. So after sex, you need to urinate after sex, even before sex as well. You take your bath after sex, because all that sweat can accumulate down there. And sweat, once again, bacteria, that's the word of the day. Bacteria. Even during the thrusting of the penis into the vagina or the finger or whatever toy that you use, there might be fecal matter from the anus going inserted into the vagina because of that thrusting back and forth action. And some people like rough sex, so that itself could cause crips and scratches in and around the vagina, and boom, it's a breeding ground for bacteria.
Right.
Yes.
So it's important to practice proper hygiene. Well, you mentioned take a bath or clean up after
Yes.
sex. Okay.
And even some of the women who use strap-ons, the person who has the strap-on on, because they don't wear an underwear, and depending on how the strap-on is, if you're thrusting, it's rubbing between your anus and your vagina.
Yes.
So that alone can bring whatever back. It's like wearing a thong. Yeah, because certain underwear we promote that the underwear itself can cause you to have an
Yes,
infection.
that is an important thing, honestly, that I should have asked earlier. Underwear as well
Yes.
for our vaginal health. What is best?
So what is best is breathing material. Cotton.
Cotton.
We encourage cotton. Why? Because although the silk is pretty and the net is pretty and we
lace.
love lacy stuff, it's not what is promoted to wear, especially when you're going out to do a task like you're going to work and you're going to spend your day doing an activity, you're sweating down there. Lace and silk don't
Tight pants.
or tight underwear, yes. They promote heat. They don't, they are not breathable material as much as cotton. And so because that heat is there and it's already a warm, delicate place, then bacteria is there growing and forming. So we save the thongs and the lace for the evening to put on a show, and dress properly to make sure, because for you to be able to put on a show in the evening, it has to be well in the day. So you wear the proper ones in the day.
Yes. So you wear something for play, but you wear something else for work.
Yes.
Yes, you do.
All right, I get you. Very real advice. Thank you for that.
Also, Miss Christian, most importantly, we need to know the health status of your partners.
Oh,
Ah.
Yes.
Wow.
Do they have any STIs? Do you have any STIs? Are there any risk, or have you had one before? Or do you have more than one partner? All that you need to know.
So that's back to what we need to know in terms of sex and the vaginal health. So the status of the partner.
Yeah.
Yes.
And you should, I don't think individuals should shy. This should be questions that you should feel comfortable asking somebody that you're interested in. Because I've learned, there was one thing that I learned that stuck with me. I'm also an HIV counselor, trained counselor.
Okay.
And one thing that stuck with me, I was at a training session and they was actually telling us, like, even when it comes to an accident, how careful you have to be in managing a blood, somebody who is actively bleeding, if you yourself have a cut, and how the transmission occurs. And so one person was saying, so if my best friend is there and both of us in an accident, why should I think of the fact that I don't have a glove or something? And the presenter at the time is a guy, he said, the one thing you don't know about your friend is what will change your life forever. And that is so real. And that is the same thing when it comes to choosing a partner or having fun. Some people just like to have fun, but you have to have fun responsibly, and you should not shy away from asking those questions. And if you're an individual that like to take those risks, or you take the risk in terms of you carefree, no strings attached, we in that type of reality we have sex, then let's get tested, because they test HIV test are done and you get the results in 15 minutes. So it's all in terms of your self-care and your healthcare, and ensuring that your vagina is well and it remains healthy, because you don't know who you're going to be. You might meet Prince Charming tomorrow. You have to make sure that you take the right steps today.
Oh, yes.
Wow. So, ladies, listeners of this spiel, Nurse Alfred said it. You might meet Prince Charming tomorrow, so you need to make sure you take care. You need to take care of that vaginal health. Ladies, I think we have covered so many areas, as it relates to vaginal health and hygiene. And I think the information that you shared has been so real and so down to earth and so relevant. I really hope that, our listeners can take heed to some of the advice that you've shared. And if they were doing something maybe that is not recommended, that they can rethink, reprocess, and take better care of the vagina of themselves. So thank you so much. But before I end, I should maybe ask the both of you if you have any parting words, any last words or any last advice, maybe, that you would like to share with the audience of the spill before we sign off on this episode? Miss Christopher, Miss Alfred.
Okay, so lately, or as of recent, being a district nurse, I've noticed that we've had quite a few individual ladies who either do their pap smears and get either inflammation or precancer cells or bacterial infection. And this is a telling sign. It means that we ladies are not doing something right. And when I say we're not doing something right, I mean that the vagina belongs to us, and it's onus on us, even if we are married, to ensure that whatever is entering our vagina, that is touching, feeling, looking, testing our vagina is healthy and is clean at the time. Because and I say that to mean because cervical cancer is caused, or the main cause of cervical cancer is the human papilloma virus, which is highly carried by men normally in the. So it means that if we're getting high numbers, it means that we're not doing our proper screening, or something is not being done, or we're not having safe sexual practices, because there are women with multiple sexual partners and they do not practice the safe sex of using a condom. Why? They just don't like the feel of it. But it's better to not like the feel of something and get the enjoyment of the ejaculation and the ecstasy feeling and climax, than having to not have a vagina that is healthy to be able to enjoy the rest of what you will enjoy now. And so I also speak to married women, because when you have your husband, you figure it's your husband and he's faithful to you. But it's not just having multiple partners. It's making sure your mouth is clean. It's making sure the penis that enters is very clean. Because he comes out work and we horny and we do, but no, you clean first, and then also after having sex, ensure that you urinate, because that is the key aspect of your vaginal health.
Yes, and on my notes, I would like to not only encourage the women, but also the men, because yes, we women, we do take care of ourselves, but what about the men? They just agree, yes, she's good, she did a test, she all right, but he's never tested. He have no idea what's his status. He just trusts her. But here he has he, she, another she, and a shim. You never know. So yes, men need to get tested, know their status, take care of their hygiene as well, because whatever they insert into us, at the end, it's going to affect us as women.
Thank you, Miss Christopher. Thank you, Miss Alfred. You all were wonderful guests for me on this episode of The Spill. And I do hope maybe sometime in the future you can come back and share on another topic. As it relates to women's health, there is never an absence of things to talk about. So thank you so much. And it was great having you on The Spill.
Welcome.
Thank you so much for having us. I am happy that you're having this type of conversations and bringing awareness to topics that people shy from. I think knowledge is power. And some of us, some of us not keen to reading, but if you bring it in that format, then the information is shared.
That is true.
You actually doing some of our work for us, in health, that's our key.
Promotion.
So we thank you too.
You're welcome.
Yes.
Thank you. Thank you so much for tuning in to this episode of The Spill. Thank you also to our guests for joining us on this episode and sharing their expertise. And thank you to our sponsor, Anumage, a cookbook by Victoria Matthew, Cohen George, and Ophelia George. If you liked this episode of The Spill, and I know you did, make sure to share it so that your friends and family can get a chance to look at it too. Remember, Women's Health Plus. Like, share, subscribe.